Hello and welcome to Fresh Perspectives. My name is Gail. My guest today is somebody who has been spending the last 25 years, along with her husband and her children before they were grown up, in the Chautauqua County area. And she is a registered dietitian, and we're going to talk mainly about celiac disease today. Her name is Barbara Halpern. Thank you for coming on, Barbara.
Thank you for having me
You're
today.
welcome. And well, first of all, we want to get to know you a little bit.
Okay.
And where did you get your education to become a registered dietitian?
Well, I was born and raised in New Jersey, and that's where I worked for most of my career. I went to Montclair State College after graduating from high school, and then I decided to become a registered dietitian, and there were 2 internship programs in New Jersey, and I was actually in the first class of New Jersey College of Medicine and Dentistry. They started a dietetic internship program, and that was around 1975, 74.
Mm-hmm.
And it was a 9-month program, and after you completed that, you took your RD exam and became a registered dietitian, and then you maintain that credentialing by getting continuing education credits, so many in a 5-year span.
Mm-hmm. Mm-hmm. Well, there's always new findings that come up, so that you have to keep learning and win new findings.
Mm-hmm.
Now, your entire immediate family is pretty much into health and wellness lines of work. Would you like to tell us what your husband did and what your daughters do?
Yes. I met my husband Arnold at Monmouth Medical Center, where he was a practicing OBGYN. And after we got married, I decided to go into private practice because I could share his office space and set up my own nutrition practice after working at the hospital for 8 years. I also was a consultant dietitian in a nursing home and taught school 2 nights a week. And I liked having the varied experiences of being a registered dietitian and what that had to offer. My daughters, we have 2 daughters, Miriam and Rachel, and they both have been coming to Chautauqua since they're 2.5 and 10 years old. Mm-hmm. And of course they enjoyed their summers here. We were living in New Jersey, but in 25 years we never missed one summer coming to Chautauqua. And after a few years we bought a home here, and we became a big part of Chautauqua Institution, where the girls would go to children's school and club and take advantage of the many opportunities that Chautauqua had to offer our daughters.
Mm-hmm. Well, the reason that I invited Barbara to be on was over the years that she has been coming to the Chautauqua area, I became aware that she was teaching nutrition classes in the special studies program at the Chautauqua Institution. So one day, I think it was in late August, when I was looking for people that I could interview during the month of September, there I saw her in the grocery store, so of course I had to go over and ask her if she would be on Fresh Perspectives.
Right.
So you want to say something about teaching classes in the special studies program?
Sure. Well, I've been a monitor with special studies for about 20 years, and I always enjoyed being a monitor. So I also took advantage some summers of doing some teaching, and mostly it centered around gluten-free eating, celiac disease, making people more aware of celiac disease and how to eat a healthy gluten-free diet. I've also given book reviews at Chautauqua and presentations through the scientific circle on vitamin D, celiac disease. I gave a presentation for Rhodes Scholar in omega-3 fats. So there's so many different topics in nutrition. I guess I'm fortunate.
Oh, yeah, yeah. Well, I think the people who were taking your classes were fortunate that they got to learn these things. Now, you were talking about certain supplements that maybe people should be taking to help prevent disease.
Well, I guess it depends on your nutritional intake and your nutritional status. However, when a dietitian takes a nutrition history on her patient that she's counseling, she can evaluate the situation and make sure if the patient isn't eating enough fish that they may want to consider taking an omega-3 supplement. That could be as well for children as well. It's very good for their brain, and it's very good for learning, and it really affects your whole body as far as omega-3. Another thing that a dietitian in taking a nutritional evaluation could assess is if the patient, also if they evaluate the blood work, if they've had their vitamin D tested. And I think it's very important for people to have their blood work include a vitamin D blood level, because many people do not realize that they are deficient in vitamin D, and that can make such a difference in how you feel, because vitamin D functions as a hormone in your body, and it can affect many different conditions. Your body aches, your bone density. For example, women will find out they have osteopenia or osteoporosis, but if they don't have enough vitamin D in their diet, then the calcium may not be utilized like it could be, absorbed correctly.
Now, you brought a book to talk about the vitamin D solution.
Right. I think for people who really want to get more information on vitamin D, that this is a terrific book to read. It's written by Dr. Michael Hollick, who actually is a dermatologist, and he is actually world famous in his vitamin D research and information. If you pick up medical journals and they discuss anything about vitamin D, you will frequently see his reference in all the publications that he has had out. And so I think that would be a terrific, easy to read book, both for a person or a healthcare provider to read. Yeah.
Yeah.
But I think it's a good idea to start with the blood test and then take it from there, because the amount of vitamin D that is necessary may vary from person to person depending on their body weight, how low it is. For example, if somebody is severely deficient in vitamin D, the doctor may decide to give them a prescription vitamin D, which is actually 50,000 international units, one a week for 10 weeks, with the hope to get the vitamin D level up to a better level. And then it is also a good idea to have the vitamin D level repeated after taking the prescription vitamin to see how far it's come up. I actually had a patient one time who was obese, who took the prescription vitamin D, and after 10 weeks, her vitamin D level didn't budge.
Was it because she was heavier?
She needs a workup. It could be because she was morbidly obese, maybe she needs more, or it could also be related to having a malabsorption syndrome like Crohn's, celiac, or ulcerative colitis, that maybe the vitamin D isn't being absorbed, so it could be an underlying reason, or it could actually be a problem with your kidneys. So if somebody has a vitamin D level of 18, which is quite deficient, and on the prescription vitamin it doesn't really change, there's a problem. So you wouldn't know that unless you repeat the blood test.
Oh, okay. So this is something that people can look into.
Yes.
The one thing that I do know is, and probably a lot of people don't do it, is up north here, we don't get enough sunshine on our bodies because of winter weather, and we really all should be taking a vitamin D supplement.
Yes,
if we
and
live
taking
here.
the correct amount. Also, I think it's important for children, because even in the summer, many children who don't have the opportunity to go to camp and be outside. They may be indoors more, watching television or on the computer. And if they're not outside, that's really a main source of vitamin D, plus your diet. But many foods in the diet, even though they contain vitamin D, they don't have sufficient quantity. For example, if we didn't fortify the milk we drink with vitamin D, milk would have no vitamin D. So milk is fortified, but you would have to drink a quart of milk to get 400 international units of vitamin D. I don't know too many people who drink a quart of milk a day.
No.
Do you see what I mean? That's my point.
I know.
So even though mushrooms and maybe fatty fish have vitamin D content, it depends on how frequently you're eating it.
Right.
Are you consistent?
I do think people should eat plenty of mushrooms for a lot of reasons, not just the vitamin D, but there's supposed to be other health benefits from eating mushrooms.
Yes.
So, okay, so we probably should move along to the celiac disease topic that you are here for.
Yeah. And actually, people who have celiac disease can also have a vitamin D deficiency because
I'm sure.
In that autoimmune condition, it's not an allergy. Celiac disease is a true autoimmune disease. And it can also be referred to as a multi-system disorder. Now that's a mouthful, but it really can encompass having problems in your whole body. And from person to person with that diagnosis, it is so variable that, in my opinion, that's probably why it's not diagnosed as much as it should be.
Do you know, is it possible if you don't go to the particular diet, if the person doesn't have it looked into or something like that, is it possible that a person, if this went on for years, could they die from?
Yes, they could. As a matter of fact, undiagnosed celiac disease can lead to a variety of serious health problems, and you don't know what they're going to be. But some cancers can actually be caused by celiac disease. As a matter of fact, a person who has thyroid cancer could have, there's 23 times more thyroid cancer in a person who has celiac disease. So it's really important to know these different situations and buzzwords, and there's other autoimmune diseases that are very much associated with celiac disease. There are many autoimmune diseases, and of course, any autoimmune disease, the body is attacking itself. So for example, with rheumatoid arthritis, the body is attacking your joints. But with celiac disease, your small intestine is being attacked. And in the small intestine, you have villi, which are finger-like projections. And when the body has an environmental trigger and gluten and the genetic makeup, you have certain genes that can turn on the celiac disease or make you in a higher risk group. Then when all these situations come together and you develop celiac disease, what happens is the villi become damaged, flattened, and blunted. So when the doctor, the gastroenterologist, does an upper endoscopy and correctly does sufficient biopsies, probably about 4 to 6, and in different areas because it's a patchy situation, and that's evaluated by a GI pathologist. It's like baking a cake. The recipe has to be followed correctly
in order for it to turn
out
the way
right.
It's supposed
If you
to.
leave out one ingredient or one factor, you could easily miss this. But when the villi become damaged, flattened, and blunted, and the pathologist identifies that problem, then the person has celiac disease. So then there's a lot of malabsorption of nutrients, vitamins, minerals, trace minerals, and then other serious consequences can develop, like neurological problems, anemia, more osteoporosis, migraine headaches. Not everybody who has celiac disease has gastrointestinal problems, so that can really throw it off. Classical symptoms can involve gastrointestinal problems like diarrhea, unexplained weight loss, but then there's something called silent celiac disease, where a person may not even have symptoms, yet have the underlying condition. And you might say, well, how could you get diagnosed with celiac disease if you have no symptoms?
Yeah, really.
Well, since it's a genetic condition, if your mother, father, brother, sister had celiac disease, that puts you at a higher risk. So knowing that, you should get tested. And for example, if a mother had celiac disease and she had 4 children, what might be a good idea besides the screening blood test for celiac disease would have the children have their genetic markers checked. The reason is, if 2 of the children don't have the genetic markers, they don't have to be watched as carefully. Mm-hmm. They don't have to be watched at all, probably, because you must have those 2 genetic markers in order to develop celiac disease. Well, let me back up. You could have one or the other, or both, but you have to have one of them in order to develop celiac disease. And there's specific genetic markers, HLA-DQ2 and HLA-DQ8. If you don't have them, you're not going to develop celiac disease. That's also good to keep in mind if there was a question on the blood work, the screening blood tests, or the biopsies that were done. If the doctor ran the genetic markers, if that patient didn't have them, well, they don't have celiac disease. However, you can have genetic markers for celiac disease and yet never develop the autoimmune condition. Mm-hmm. Do you follow that?
Yeah. Now, I'm assuming that means that is there a certain lifestyle that will help prevent the genetic,
Yeah, they have done much research on that, but I'm not sure there's anything really definitive as far as that goes. For example, if that child is, or that adult has the markers and they have a strong family history, I don't know that there's too much you can actually do to prevent it. Mm-hmm. But any trigger, environmental trigger, possibly could create any autoimmune condition. Mm-hmm. Some people develop an autoimmune thyroid disease after a pregnancy, but you can also develop that with, that could be a trigger. Or you could have a trigger maybe from an antibiotic or another autoimmune condition. For example, in the normal population, maybe 1 in 100 people have celiac disease.
1 in 100?
About 1 in 100.
That's a lot of people.
It is.
To have
1 in 100.
Particular
However, in an autoimmune a person who has another autoimmune disease, the rate increases. So if you had type 1 diabetes, or you had autoimmune thyroid disease like Graves' disease or Hashimoto's thyroiditis, or rheumatoid arthritis, or even a person who has Down syndrome, they know for sure that your risk is a lot higher. It might be 1 in 10 or 1 in 3.
So do you think that probably a lot of Down syndrome people probably have it?
Yes, they do. And I've had people who have Down syndrome and they have had celiac disease. I mean, you can't just say everybody with Down syndrome has celiac disease, just like everybody with type 1 diabetes doesn't have it. But the incidence is definitely greater. So if you were going to a nurse practitioner or a physician or a healthcare professional and they didn't know that, they wouldn't be inclined to even order the screening blood test. Mm-hmm. At least if the physician orders the screening blood test, or any health professional who is capable of ordering a blood test, does it, then at least you have a result where you could refer the patient to a gastroenterologist and have it properly diagnosed by the upper endoscopy, which must include those biopsies in the small intestine.
Mm-hmm.
Another interesting factor is many patients go to gastroenterologists for other conditions like acid reflux or heartburn or different reasons. But if the gastroenterologist doesn't do the biopsies in the small intestine, they were not checked for celiac disease.
Mm-hmm.
Also, if you have a colonoscopy only, you are not being checked for celiac disease.
Mm-hmm.
And also you have to have sufficient biopsies. 1 or 2 doesn't do it. You have to have at least 4 or 5 because, as I said, the villi, and it's such a large area, can be patchy. So you need to know where to biopsy and do at least 4. And then there's something by Dr. Peter Green that he even mentioned that it was very important to do a biopsy on the duodenal bulb, which is an interesting thing just to remember, because if you're a gastroenterologist, if you remember that, you may just get the diagnosis just from that one biopsy in that area.
Mm-hmm. Yeah. Yeah, I know there's somebody that I know that has an autoimmune disease called mast cell activation syndrome. But she also does have to be on a gluten-free diet. And, well, she controls it with the situation with her diet. She's a lot healthier than she was. I think she even had this problem when she was a child, but they hadn't figured out what it was or anything. Like she would gain weight really easily and things like that. And but I do know she can't eat gluten as well. And in fact, corn could kill her. You know, and that is in so many
products.
Yeah. She literally will not eat anybody else's cooking. She fixes her own food because she knows what she can eat.
Right. Well, I became interested in celiac disease after being a dietitian for many years, and I have to say that only in the last 20 years has our population in our country begun to be diagnosed. When I read that book, it said 97% of patients who have celiac disease were undiagnosed, and I don't think the amount has dropped that much. Maybe now it's about 85% are undiagnosed. But
well, this is the book that you're referring to here, Celiac Disease, a Hidden Epidemic.
By Dr. Peter Green, and he is the director of the Celiac Disease Center at Columbia University Medical Center in New York City, where I attended classes and seminars, and he has very strong patient education and healthcare professional courses for doctors, nurses, dietitians, pharmacists, because the gluten-free diet, which is the cure for celiac disease, that's why I was very interested in it, has to be done correctly as well. But besides avoiding the gluten grains, there are other hidden sources of gluten that can come into a person's diet that they may not even suspect as being problematic. Even medications can be a problem. And it is always a good idea for a person to check with the pharmacist to make sure, especially if the medication is generic or changed or whatever, that the medication doesn't contain gluten.
I don't suppose you know offhand any medications in particular that would contain gluten?
It can change.
It can change.
And the interesting thing is that when I first became interested in celiac disease, even the food products were not labeled gluten-free. And it was only after I became really interested in the topic that the food labeling started to change. But it's still my impression that it's only voluntary by the food company. Also, you know, reading label ingredients is important because they have to list the 8 allergens in a product. I don't know if I remember them off the top of my head, but you may see that the allergens would be something like if it contained soy, or if it contained wheat, or if it contained milk, or fish, or tree nuts. You know, the 8 major allergens would be listed. However, somebody who, they don't have to list things like, as an allergen like barley malt. However, if you're on a gluten-free diet, you really can't have barley malt. So if you would see that in a cereal, you'd have to know that you couldn't have it.
Mm-hmm.
So
Yeah.
the grains that you can have on a gluten-free diet would be wheat, rye, oats, and barley. Wheat, rye, oats, and barley. And a whole education process has to take place for the person to follow that correctly. Mm-hmm. It can be difficult and challenging initially, especially for people who are buying prepared food, eating out, not really doing their own cooking, traveling a lot. It's a whole educational process. But also, as a dietitian, these people are already challenged nutritionally with vitamin mineral deficiencies because of the malabsorption occurring in the small intestine, because of the villi being damaged and flattened and not absorbing those nutrients. So the whole emphasis is on healthy, good, normal nutrition, but avoiding gluten. So you also want to educate the person into the gluten-free grains, which are really, for most people, unheard of. Things
Mm-hmm.
like amaranth and quinoa and teff, and you know, you see what I mean? And people maybe who don't eat a lot of rice. People like to eat pasta. They need to find a good gluten-free pasta that they enjoy, or a good cereal that they enjoy. So it takes a whole challenging experience to really learn the gluten-free diet. But once you get it down pat and you know the products that you enjoy, it's really okay.
I've heard I've had people tell me if they have somebody in their family with celiac disease that they cannot share the rest of the family's condiments, like mayonnaise and so forth.
You want to have you don't want to have any cross-contamination. So for example, if you would put a piece of toast in the toaster, mm-hmm. That's gluten-free, the chances of it being somewhat contaminated because of the crumbs that might be from the other, mm-hmm. it really mm-hmm.
So they would have to have their own personal toaster then?
It wouldn't be a bad idea. Unless like a pot or a pan was thoroughly cleansed, then it's really not a problem.
Mm-hmm. But and that's really hard to do with a toaster.
Yeah, yes. It is.
Yeah, so
it wouldn't be a bad idea.
Now you had some interesting stories about cases of celiac disease of people that you have helped. Would you
as I became more aware of the condition, not just teaching the diet, but aware of the condition, I would find myself trying to screen each person that came in, no matter why they were coming in the back of my head, for celiac disease. Mm-hmm. So for example, I had a girl come in who had an eating disorder, and she was 18 years old, and she'd been going to a hospital in North Jersey for what they diagnosed as bulimia. Mm-hmm. She really wasn't thin. She was on quite a few medications for depression and different things. She had problems with constipation. And I kind of put 2 and 2 together and said to her mother, why don't you have her taken to the gastroenterologist and have her checked for celiac disease? So lo and behold, she calls me back 4 months later and says she had it. But people who have celiac disease can have a variety of gastrointestinal problems like vomiting and nausea and heartburn and indigestion and constipation only, or diarrhea only, or Irritable bowel syndrome. Actually, irritable bowel syndrome doesn't say much because you have a problem with diarrhea or constipation, but could easily be coming from celiac disease. And if it wasn't checked by the blood test or the endoscopy with the biopsies, then you're still in the running to probably have it, unless it's ruled out. So she did have celiac disease. So I always think that sometimes if you get one case, that there's probably a lot more to be discovered.
Oh, sure.
Yeah, I've had another woman who had a lot of problems and was hospitalized for vomiting, and she was obese, and she also had celiac disease. They couldn't figure out why she was vomiting all the time. People who have migraine headaches, fibromyalgia.
Oh,
You
you hear a lot about that.
You do. That can be underlying. Get checked for celiac disease. Also, children who have failure to grow, you know, a 13-year-old who's very short and not really gaining weight, they should get checked out for celiac disease. They may not have any other signs or symptoms. So you mentioned that my daughters were in the healthcare field as well. They're both in the dental field. So of course I heavily influenced them because I found out that a child could have dental enamel defects on their teeth, and that may be the only sign or symptom of celiac disease. So the dentist, the dental hygienist, has a perfect opportunity to find it, see it, and say something to the parents. If you miss the opportunity, then it may be many years later until that child has other problems and gets diagnosed. So better to do it early. Another mouth problem could be, oral problem, could be canker sores or mouth
canker
sores.
sores,
Yes.
yeah.
So a person who has canker sores or mouth sores should also get checked. I would say every healthcare provider has the perfect opportunity to at least do the screening blood test. And another challenge is that most people, or many people, need a referral in order to go to the gastroenterologist. So if the person they're seeing doesn't do at least the blood test, the screening blood test, what are the chances of even getting to the gastroenterologist without a referral or a good reason?
Yeah, well, you want your health insurance to cover it too.
Well, yeah.
Yeah, so.
Yeah, but if you don't have gastrointestinal problems, say you're anemic, some people go through iron infusions before they finally realize that they need to see a gastroenterologist and rule out celiac disease.
Oh, yeah.
So that's a typical
so,
case
so
of
it
silent.
can cause anemia too
Yes,
then.
can cause anemia too. So it's a multi-system disorder. It can affect your whole body.
Oh, yeah.
At any age.
Yeah.
Some people were under the impression too that if you don't have diarrhea as a child, that you don't have celiac disease. So actually a person 60, 70, 80, and even 90 years old can easily be diagnosed with celiac disease.
For the first time in their life.
For the first time,
yeah,
yes.
Yeah. These people 80 and 90 and like that, could they possibly have been having?
Yes. You don't have to be very ill to have celiac disease, but you could just have, you know, whatever happens to our bodies, we think is normal. It's normal for you, it's normal for me. But some people suffer with chronic constipation or frequent bowel movements, diarrhea, and they think this is normal. Or to have constant, you know, stomach aches, and blame it on something else. You know, we're always blaming something on something else. But I think sometimes bringing a topic up like this is very good because it's so varied. And if we always blame it on something else, oh, I have headaches because I'm depressed, I have headaches because I didn't eat, or I have anxiety. But these are all symptoms of celiac disease: anxiety, depression, migraines. It really does affect your whole body.
Now that you mention it, I can remember in past years various elderly people telling me that they couldn't eat whole grain bread without getting diarrhea, you know, and, you know, these are people that are dead and gone now because they lived to be in their 90s, but I can remember people telling me that about themselves, and now having this conversation with you, gosh, maybe that was why they had the problem, was maybe they had celiac disease or something like that. So.
And it really is underdiagnosed, because you can see how many steps you have to really go through. It takes the average person maybe 10 years to get diagnosed.
Wow.
Yep,
That's
because
a
they go
long time.
they can go from doctor to specialist. So if the endocrinologist doesn't pick it up, and the medical doctor doesn't pick it up, and then if they go to the gastroenterologist and he only does a colonoscopy, it doesn't get picked up. Another interesting case I had, this is when I was first interested. I had a woman who was under the care of a physician for 30 years for ulcerative colitis. And all of a sudden she had rapid weight loss. And she was being referred to me. And I asked her if she ever had an endoscopy or a blood test for celiac disease. She said she never heard of it, and no, she never had an endoscopy. So I suggested that, and she definitely had celiac disease in addition to the ulcerative colitis. You can have celiac disease with Crohn's disease as well.
Both of those?
Yes, you can have both.
Well, in comparison to celiac disease, what exactly is Crohn's disease? How is that different? Celiac
disease, Crohn's disease, ulcerative colitis are all inflammatory bowel diseases, and they're all autoimmune diseases. And autoimmune diseases like to cluster. They like to cluster. And the symptoms can overlap. You can have diarrhea with all three. You could have constipation and, IBS with all three. But that's why it's important to have a colonoscopy and the upper endoscopy so that the doctor can make the correct diagnosis on where it's affecting the colon, do you see what I mean? But you can have the same symptoms.
But you'll never get rid of the problem if you don't get the gluten out of your diet.
Right. Well, I always tell people who get diagnosed with celiac disease, I think there's 100 autoimmune diseases now, or maybe 80 to 100.
There's a lot.
There's quite a few. And I always say, well, if I had to pick an autoimmune disease to have, I think I'd pick celiac disease, because all the others seem to have, treatments and medications and, really that you're really dependent on to keep it under control. But with celiac disease, it's really just your gluten-free diet. And once you have that down pat, things start to heal. There's less inflammation in your whole body, especially your gastrointestinal tract. And your anemia improves, your vitamins are being absorbed, and you can really live happily ever after.
Do you know if celiac disease, do any psychiatric problems ever have anything to do with it?
It's interesting that really and truly there's a whole chapter in there on depression. You can imagine if you have an autoimmune disease that's causing constant inflammation in your body, and you don't know why you're having these headaches, or anxiety is a very common complaint, and you just don't know why, and you're going to all the doctors, and you're trying to take all the correct medications. And actually, at one of the international meetings that I attended, I think it was in Chicago, they actually discussed schizophrenia.
Ooh.
And that possibly the gluten-free diet would have a big benefit for people with schizophrenia. So there's a lot of conditions that are interrelated. I mean, I'm only talking from the point of view as a dietitian who took an interest more than just in the diet. But I don't know, the correct answer to give you exactly, except that a lot of things seem to overlap. And I can imagine that most people who have this condition feel miserable until they get on the gluten-free diet.
Yeah.
I'll also mention one other interesting thing. There's a condition that's related to celiac disease called Dermatitis Herpetiformis. And that's a skin condition that's red, itchy, and blistery. And it comes and goes, and it can be on any part of your body. Now, if you go to a dermatologist and he does the correct biopsies for this, Dermatitis Herpetiformis, it's blistery, it comes and goes, and he sends it to a pathologist who's an expert in skin, and they come up with that diagnosis. You have celiac disease, but it affects your skin.
Mm-hmm.
So you don't really even need to go to the gastroenterologist and have the biopsies in the small intestine. You may or may not have damage there, but that cure is the gluten-free diet as well.
Oh, yeah. Well, you know, I've heard similar things about psoriasis.
Mm-hmm. Yes.
There's a thing called Leaky Gut Syndrome, where you can get little pinprick-sized holes in the lining of your stomach, and this is what I was told by somebody, and not just anybody.
Yeah.
I mean,
Yeah,
you
yeah,
know,
yeah.
people that were teaching like health classes, and that actually with these little pinprick-sized holes, the stomach acid can leak out and cause sores, really bad sores, psoriasis on the skin.
Well, I'm not sure exactly. I mean, I can't comment on that, but I will confess one thing to you. I do have psoriasis.
Oh, do you?
And I do not have celiac disease.
Mm-hmm.
But I will share with you that I have been following a gluten-free diet, and I have to tell you that I had psoriasis since I'm a little girl.
Mm-hmm.
And I always had to have a lot of expensive medications.
Mm-hmm.
And since 2012, I haven't taken anything to control it except the gluten-free diet.
And it's cleared up?
Yes.
Wow.
Now,
Yeah.
that may not happen to everybody,
Mm-hmm.
but it did happen to me.
Mm-hmm.
And I had psoriasis since I'm a little girl.
Mm-hmm. Wow.
So, I mean, if you want me to give a testimony,
Yeah.
but I mean, to be honest, I didn't know you were going to bring that topic up.
Well, I just thought of it just now,
Yeah.
you know.
No, but it's
So,
really interesting. But I really think, too, I have to be honest with you. I don't just think if a person listening to me has psoriasis and they go on a gluten-free diet, are they going to clear their psoriasis? I really don't know. But I have to tell you that I did everything in my power with research, with even vitamin D.
Mm-hmm.
Has a big effect on your autoimmune conditions, and it can prevent them and it can help them.
Mm-hmm.
Make sure your vitamin D is good, which I did. And I also feel that the omega-3 supplement that I take also is very helpful for skin and a lot of things. So I think that it takes a lot of things to make a person better, not just the pill, not just the diet, but a lot of things working together to really help a serious condition improve. Because with psoriasis, it's inflammation.
Mm-hmm.
It's inflammation of the skin.
Mm-hmm.
And I don't know if it comes from a leaky gut or not, but I think a healthy diet can only help
Mm-hmm.
by reducing inflammation and having the right nutrients in your diet, and I think it really will give some improvement.
Mm-hmm. Yeah, I just wondered about that. Now, I was thinking, you know, there's kind of a problem that I have, that if I go for a really long, I don't know if this would have anything to do with it or not, but if I go too long without eating a meal, as long as I eat 3 meals a day, I'm fine. But if I go too long without eating a meal, I will get the symptoms of low blood sugar. Do you know
Yeah,
what
I'm sure.
that would have
I'm
to
sure
do
you
with?
could. I'm sure anybody could become hypoglycemic if they go long periods of time without eating. And actually, many people don't eat breakfast, and then maybe their lunch isn't that great. It's haphazard, and they can develop headaches and or migraines, even trigger migraines. I find that if I give somebody that simple suggestion, to eat breakfast, or because they're feeling so poorly, that usually their headaches and their hypoglycemic symptoms are greatly diminished.
Mm-hmm.
And other people who really have a problem with diagnosed hypoglycemia can also improve the way they feel by having a snack mid-morning and also an afternoon snack, and probably with the emphasis on a good protein snack and taking in less concentrated sugars and sweets, because that can also trigger more hypoglycemic feeling, because your pancreas is producing insulin in response to the sugars that you're taking in,
Yeah,
and then it can make your blood sugar drop. Yes.
Yeah. So let's see, we have about 12 minutes left here. Now, is there anything else we need to know about celiac disease, or?
Well, let's see. Well, maybe I could share with you a couple other cases that I thought were rather impressive and kind of stay with you for a while. I think for any healthcare professional who is interested in this topic, that really to read Dr. Peter Green's book or attend any of the seminars that they give in New York City, all healthcare professionals need to do continuing education in order to maintain their license or whatever. So that's a really good topic, and I think you'll get a lot of benefit out of it, and so will your patients. A couple cases that I had, and I think it's important, if you know somebody who has celiac disease, I think they should be encouraged to share it with their immediate family members, siblings, even cousins, because I once had a man who came to me after visiting 5 gastroenterologists and finally got the diagnosis of celiac disease. In the meantime, he had a brother who lived in another country, I think it was Norway or Sweden, and he said, if only my brother shared with me that he was diagnosed with celiac disease, I wouldn't have had to go to 5 different doctors to get diagnosed. So the point is, because there was a family history, it's so genetic and so inherited that if the brother only told him, hey, I got diagnosed with celiac, he would have known that his problems could definitely be related.
Oh, yeah.
If you see something, say something. But I think a lot of people don't want to share their personal information, and I don't blame them, but this could be a real helpful thing to share.
Definitely with family members.
Your brothers, your sisters, your parents, your children.
Or if somebody that you know, like a friend or acquaintance, happens to mention, oh, I always have these symptoms. The other thing, when I first became interested, I think the healthcare professionals thought, the authorities in charge thought, that this was only like a cultural thing, or that it was only affecting certain groups in the world, like Eastern Europeans, etc. So you wouldn't think that it would affect a person who wasn't Caucasian, for example, right? But I had a lady who came here from Haiti who didn't even speak English. She must have been about 60 years old, and I still remember she came to visit her daughter from Haiti, and she was so severely anemic that the daughter took her to the doctor. And the doctor sent her to the gastroenterologist, and she was severely anemic. And so here's this woman from Haiti who doesn't speak English, who has a diagnosis of celiac disease. And again, think about the health care in Haiti as opposed to here. It's not that great. The poor people in Haiti, they're lucky if they have a medication to take, right? So here, it was an eye-opener for me. But it is true, it's a worldwide problem. Worldwide problem. Oh, yeah.
And with, we're marrying different cultures, you know what I mean? So the gene pool is being shared, so it really is a worldwide problem. And the fact that it has increased fourfold, the incidence has increased fourfold, and you might say, well, how would you know that? Well, there was an article in the Journal of Gastroenterology where they had to prove that it quadrupled. The incidence actually quadrupled, not just because of awareness. They save blood from the military, from soldiers, say 50 or 60 years ago. And when they analyzed the blood samples, the incidence wasn't fourfold. Do you see what I mean? The incidence then was what it was, but 50 years later, the incidence now is fourfold. So they knew that celiac disease is on the upswing.
Oh.
It's not decreasing. It's increasing.
You mean they seem to think it has to do with...
It could have to do with a lot of things. First of all, the flours and the breads and the products that we're eating are not like they used to be.
No.
So, I mean, you know, maybe more GMOs, who knows? But, you know, or maybe our intestine reacts to things like this. Mm-hmm. There could be so many things. They've done a lot of research on, you know, breastfeeding babies versus formula feeding versus, you know, so many things. But there definitely, you'd have to be genetically inclined. You have to have gluten, and you have to have the trigger, whatever that is. Mm-hmm. It can get triggered at any age.
Yeah, I have heard that the grains now are different. Mm-hmm. I think they were genetically modified or something because they wanted grains that were different in some way. I'm not sure I understand what that was all about, but mm-hmm. Yeah, the whole wheat that we have now is not like the ancient mm-hmm. whole wheat because of something they did to cause it to change. So
the other interesting thing, I'm just thinking of another lady who was referred to me by a neurologist, and she was about to go on medication for MS.
Oh, really?
Uh-huh. But she didn't really have MS exactly when the diagnosis finally came through. She went to a gastroenterologist, and she had positive blood screening tests for celiac disease. And he did a biopsy, and the biopsy came back from the pathologist as being negative.
Oh.
So it was just her luck that I went to this seminar in New York City, and I waited on a long line to ask Dr. Peter Green his opinion on what to do. So, or get his advice to share, because, you know, did she need the diet? Does she really have it? The blood work's positive, the biopsy's negative. This is a good thing to keep in mind, that maybe it wasn't a GI pathologist who read the slide.
Oh.
Well, I mean, a pathologist could read it, but not every hospital has GI pathologists, but they can be sent away. And maybe it does need a second opinion. Mm-hmm. So the interesting thing is that the biopsy, I think by law, has to be saved for 7 years anyway. So you can always go back and get the slide and have it reevaluated by a GI pathologist. And in her case, that's what was done, and she had it. Mm-hmm. So, and also they did the genetic markers, and they were positive, so she really did have it. But it can get missed, just like baking a cake. If you leave out the sugar, it's not the same cake.
No, it's not, is it?
No.
Yeah, I know there's a lot of people with a lot of different symptoms going on.
And I would also say, like with the screening blood tests, not every doctor does all the ones, you know, they do it. But even if a patient has negative blood screening tests and they have a lot of symptoms, they should definitely go to the gastroenterologist and have the endoscopy with the number of biopsies, because there can be patients who have negative blood work and still have the problem, for sure. Now, there's one other condition I might bring in real quick, because I think this is on the same lines.
Right.
A person could also have gas, bloating, diarrhea, constipation, or a lot of gastrointestinal problems, and not have celiac disease. Mm-hmm. But there's another thing that I feel that's underutilized, that a lot of people don't know about, mm-hmm. and a lot of the doctors don't have the machine in their office, but it's a condition called, I'll abbreviate it, SIBO, SIBO or SIBO, and that stands for small intestinal bacterial overgrowth.
Overgrowth of
Yeah.
the bad kind of bacteria.
Well, they have bacteria where it should not be, and then when they eat certain foods and the bacteria thrives on the sugars or whatever it is that's coming in that they're thriving on, it creates gas and bloating, and in some people that's all they get. Some people, in addition, get diarrhea or constipation. You can also have weight loss. You can also have multiple vitamin mineral deficiencies because of the bacteria eating your nutrients. And you might say, how do you pick it up? With a hydrogen breath test.
A hydrogen breath test?
Yes.
Is that kind of like what the cops do when they stop somebody who's been drinking?
It's a very simple test, but there is a little prep diet the day before, and the morning of you drink a lactulose syrup, and then the gastroenterologist's office tests your breath for like 3 hours, and if the number rises to a certain degree, you have the condition. Now, why that's important is that you need a special antibiotic to get rid of it. It can also occur with celiac disease. So for example, if you get tested for celiac and have it, and the gluten-free diet isn't doing the trick, it could be that you have the SIBO as well. So you see what I mean?
Yeah.
It's like a lot of pieces to a puzzle. But there is a special antibiotic that happens to be quite expensive, though, that you can take to get rid of it. It's called Xifaxan. And in addition, a dietitian can also be helpful because there's a diet that you're encouraged to follow called the Fodmap Diet. If people want to Google this or read more about SIBO, you can on the internet, and you can also read about the Fodmap Diet. It's FODMAP, Fodmap Diet. And it's an abbreviation for a lot of things.
Oh, okay.
But you know what I mean?
Okay. Now, I remember the day that I saw you in the grocery store. You were glancing into my grocery cart.
I was. You think I was.
Yeah. You noticed something. That's why you were doing it.
it?
You noticed something. And it was something that my husband likes me to pick up for him. I don't eat it myself.
I don't even remember that.
It was something about some sort of a crab, something or the other. And you said, it was something about, you said, I see you're buying that. That's gluten-free. And
You said that?
Yeah. It was something that I had. You don't remember what it was.
I don't remember.
And I remember you said that you buy it yourself. And
what was it?
but it was, well, he has me get it whenever there's like
I don't
a
remember.
special on it. Every once in a while they'll have a buy one get one free on it.
Yeah.
And so when that happens, he'll have me go get it for him. And but you don't remember what it was. It was like sort of crab or something
remember.
like that. Well, anyways, you said it was gluten-free, you know. So anyway, you brought up the subject right away. By something that I had in the cart. But well, we've come to the end of another episode of Fresh Perspectives. And I'm really glad that you came on because this has been a really interesting topic. And I think that maybe if somebody in my viewing audience that has been having symptoms that they haven't been able to figure out what's going on with them, maybe they'll go get tested for celiac disease.
Or vitamin D deficiency.
Or a vitamin D deficiency. So thank you so much for this really important information.
Oh, thank you for asking me.
Oh, you're welcome. And I'll see the rest of you in the viewing audience on the next episode.